Okay, stop the video. Quick backstory. You're about to watch a video as I adjust my patient Elmer. He used to suffer from debilitating back pain due to a condition known as canal stenosis. He wanted to make this video so he could show his friend from another town just how gentle the adjustment is. So Elmer said we could use this video also to share with our own community. So I'm curious, what do you think of the adjustment? Does it look gentle to you? Comment below. Now, before any treatment, a proper assessment is done, and this particular orthopedic test checks for any compression of the low back and extension range of motion. That's followed by palpation and checking leg length. While I'm palpating Elmer's back, I actually look to see how that affects his leg length or the tone and nerve pressure going down his leg, which is common with canal stenosis. Along with x-ray analysis, now we have a specific listing or direction of how we want to treat Elmer's spine. Now here you can see I've put blocks to leverage Elmer's spine into flexion, which is important for canal stenosis. At the same time, I'm using his knee and his mid-back to traction or decompress the area of compression. Now the adjustment is just part of the treatment. It is the most important part, but in order to properly warm up for the adjustment, Elmer has also used a wobble chair to help loosen up his back, compress and decompress the disc joints of his low back, which naturally loosens the muscles, and also using neuromuscular re-education or balance techniques, which are absolutely imperative for a back injury. Now I'm going to use an adjustment instrument called an arthrostem. It's going to tap Elmer's spine, or specifically his L5 joint, 7 times per second, percussing it. So instead of like a traditional adjustment, this is a much more gentler approach and just as effective. It's pretty funny actually, when Elmer's friend saw this adjustment and he saw Elmer's legs coming up into the air, he thought that the arthrostem was shooting electricity into his leg, forcing it to come up. But I was actually having Elmer lift his leg for the purpose of creating mobility plus stability. For the best results in canal stenosis, we treat Elmer's entire spine. The neck plays a huge role on the overall mechanics of the spine and how it affects the low back. So we use the arthrostem, which remember taps about 7 times per second. And while I have Elmer actually putting his head into flexion, or he's bending his chin to his chest, I have him pushing his head into my hand, creating resistance, which allows us to loosen the muscle as we mobilize the joint. Very effective. To stabilize the adjustment and get better low back strength, I'm going to put resistance on Elmer's back as he goes through his full range of motion in flexion while applying the arthrostem along the muscles. And of course, after treatment, Elmer is all smiles. Hope you enjoy. Now, if you found this video helpful, please share it with your friends, put it on your timeline. You never know who could benefit from this. And there's a lot of people out there who have this notion of what chiropractic is. And some people are incredibly afraid of chiropractic when I can assure you, gosh, it's safer than a Tylenol. So there's no reason not to get checked by your chiropractor if you are suffering with debilitating back pain.